Time for Health Watch. 8/18. You know, March is National Colorectal Cancer Awareness Month, but fighting the disease is a year-round campaign for at least one man from the Mid-South who's had a personal impact with it. And now he's taking his message to the masses by way of the Big Apple. The bright lights of Broadway, but the big screen in Times Square, where a native Memphian left an indelible mark.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States.
Since learning of his father's diagnosis of colon cancer, Devin James has made it his mission to try to stamp out this disease. He became an unwilling witness to the devastating effects colon cancer can have on a life. James remembers happier times.
My dad had 22-inch arms. My dad's always been a really buff, in-shape person. He's a fitness person, you know, we call him a health nut or whatever, loves to eat right, loves to work out all the time. And so, you know, he was the embodiment of strong, if you ever, you know, were to think about a strong man.
Now James hopes that by sharing his father's story, he can save the lives of others.
Unlike some of the other cancers, this is a preventable disease if you catch it early enough. If you know, we get the awareness out there the way that it should be, 60% of the people who die, you know, who are estimated to die could not, and they could live, and they could go on and be advocates and help us with this fight.
The cause, so close to his heart, led him to New York City on March 1st with a public service announcement featuring one of country's biggest names, Lady Antebellum. But it also caused him to change his own life.
Especially when you're a business person, you travel, you make all these excuses for why you can't eat right and, you know, whatever. And so I just had to throw that out of the window because now that my dad was diagnosed, I have a family history, so I'm more likely to be diagnosed later on in life.
According to the CDC, colorectal cancer is the second leading cause of cancer-related deaths in the U.S. Early screening helps prevent the disease by allowing doctors to find and remove precancerous growths or polyps. The number of people receiving colonoscopies has increased in recent years, but there is still work to be done.
If we could just get people to talk more about it, that's what I would like to drive home. I think that the conversation will spark, you know, people's interest and lead them to get screened. I mean, we can't prevent it if you don't talk about it.
James' father has been in remission for 1 year. It's generally recommended that both men and women receive their first colorectal cancer screening at the age of 50. However, if you have a parent who's been diagnosed with the disease, you may need to be screened much earlier. For a link to learn more about colon cancer, go to our website, myfoxmemphis.com. And when we come back,